and welcome to the Telford and Wrekin Health and Wellbeing Board meeting. Due to the current COVID-19 regulations, today's meeting is held using audio conferencing software and available for the public to listen to via the link of the agenda page on our website or via the Council's YouTube channel. This ensures that all those interested in the proceedings can see and hear how decisions are made. Before we start the meeting today, Tuesday was a day of national reflection for the first year of the pandemic lockdown. I'd like to take a minute's silence to think about the 256 people in Telford and Wrekin who sadly lost their lives to coronavirus, and to express our condolences to their family and friends. So if we could take a minute's silence. Thank you. Okay, so only the people who have been notified by Democratic Services team prior to the meeting will be able to speak on public questions and will be dialed in by telephone. If you could put yourselves on mute, and if you'd like to speak, raise your hand, that'd be great. To the item agenda presenters, each item has roughly 15 minutes to ensure all items are heard within a 2-hour period. If your report was sent in advance, could you summarise its main tenets to ensure there is adequate time for discussion? Please can I thank Dr. Julian Povey for his time as Joint Chair of Shropshire, Telford and Wrekin Clinical Commissioning Group and as Co-Chair of this board, as he returns to work full-time as a partner at his GP practice. Likewise, can I thank David Evans, Accountable Officer of Shropshire, Telford and Wrekin Clinical Commissioning Group, for his service in leading and supporting healthcare in Shropshire and Telford and Wrekin, and wish him luck in his future role. Apologies for absence. Do we have any?
Yes, Councillor Middleton, we have apologies for absence from Dr. J. Povey and Councillor Shirley Reynolds.
Thank you. Declarations of interest, I'll take silence as a no. David?
Sorry, it was an apology. Can I just give apologies for Julian because he's on leave this week as well?
Yeah. Thank you. Anybody got any declarations of interest? No. Thank you. Minutes of the previous meeting. Is everybody happy? Is anybody happy to propose and second? Karen?
Yeah, I'll propose and chair.
Second, Barry? Yeah. Thank you. Got any public speakers?
No, Chair, no public speakers today.
Thank you. Item agenda 5 is the Outbreak Control Plan from Liz Noakes and Nikki Mitchell. Thank you.
Hi, afternoon everyone. Nikki's going to take us through a presentation, but if I just start off in terms of, firstly, let me inform the board that currently our 7-day COVID infection rate is now fluctuating at 32 per 100,000, the second lowest 7-day infection rate in the West Midlands, which is good news. And I'd just like to, in a sense, reflect back. We've had, through the pandemic now, 10,803 cases of COVID since the start of the pandemic. That isn't actually all the cases because during the first wave, community testing hadn't started. but that is the 5th lowest infection rate within the West Midlands, with only Shire counties with lower rates than ourselves. And sadly, as we remembered those that have passed during this pandemic, 256 people have died within the borough, each one a loss to the family and friends and the community. But again, the death rate from COVID within the borough has been lower than the national average, and particularly low given our level of deprivation. So now we move into the next phase of the pandemic. We've been asked to refresh our local outbreak management plans. The board approved the outbreak management plan last early July, and the Department of Health and Social Care have asked us to refresh these plans to be prepared for the next phase, for future outbreaks, new variants, and to continue to be proactive in terms of our COVID defences, and particularly improving immunisation uptake, and particularly making sure everybody has an immunisation going forward and reduce those inequalities. So I'm asking Nikki to go through a quick presentation with you, and I will take questions at the end. Just so that members are aware, we have had to submit our plan to the regional team. They have fed back on the plan to say it is a strong plan, very strong plan, with very good outbreak management structures, and clearly demonstrating the high level of expertise we have in the team and the knowledge we have of our communities. So, and I would like to thank Nikki Minchell and Helen Onions and all the work of the Health Protection Hub and lots of other council colleagues that have worked hard to manage outbreaks and deal with cases within the borough over these last few months. So Nikki, would you like to take the presentation, please?
Yes, thanks, Liz. Can everybody see the slide that I've put up? Yeah, brilliant. So before we start talking about the plan, what I'd just like us all to reflect on, and Kelly's already touched on this, is the journey that Telford and Wrekin has been on in terms of the COVID pandemic. And this slide demonstrates, you know, where we have been from an epidemiological perspective, the number of cases, and fortunately the number of deaths and the hospital admission. So it shows that we have dealt with significant numbers over a long period of time. This slide, I think, and again, just a reflection from board members, that the COVID response has not been a one-team response within Telford and Wrekin, and this slide demonstrates that it's taken a whole council response to deal with the consequences of COVID. So you can see there some of the amazing statistics and some of the sad statistics that are pertinent to our COVID journey. One of the things that the review of the local outbreak management plan asked us to consider were our best practices. And I've got a couple of slides coming up that deal with some of those best practices that we highlight within the plan. But I think one of the sterling pieces of work that we have done throughout this, and I know that my officers within the hub, because they are regularly talking to people who have unfortunately got COVID, one of the things that they've been very complimentary about is the way that we have engaged with residents across the borough. And this slide just demonstrates some of the many ways that we have communicated with our residents to advise them of the changes and steps within that pandemic process, right from the early initial letters to everybody within the borough, and that there have now been 3 letters going to borough residents, through to more recently trying to engage with groups that are perhaps resistant to vaccine, and the talking heads videos. So I think that this slide just demonstrates the many ways that we've tried to communicate the COVID messages to our residents. As I said, that what the review required us to do was to actually reflect back on our best practices and lessons learned, and there are many on the next 2 slides, but I'm just going to pick out a couple if I can, just to highlight some of the work that was done. So Within the contact tracing and outbreak management, one of the things that we did very early on in partnership with Shropshire was to develop our own bespoke case management system. This enabled us to have an online notification form that is used widely amongst all our educational settings, our care settings, and increasingly more and more workplaces. What this has enabled us to do is to know about cases that are positive and to contact trace them before they've hit the national system and come back to us. Very often in workplaces, the positive cases are not resident within Telford, so we would have never known about them, and therefore would never have known about cases that were happening within our local workforce. Using that notification form, we've been able to work with all the settings to provide that COVID secure advice and to get in there quickly to stop any further transmission. The intelligence and surveillance that we've been able to achieve through the Powered BI dashboards you saw in the first slides, examples of the data that we've been able to produce. And again, this local intelligence has really helped us to understand what's happening within the borough. You may recall, again, it's for the communications, and this is where it all ties in, the communication to specific wards within the borough, asking them to come forward for testing when we got particular worries about what was happening within those wards. And this is all coming out of that local intelligence that is analysed on a daily basis to help us understand what's happening. In compliance and enforcement, there's been a lot of COVID secure work that is done from members of public protection. But the one thing that I just want to bring out and talk to you about is the spot check pilot with HSE. HSE were given money by government to work with local authorities on COVID spot checks, and up until the pilot that they did with Telford and Wrekin, they'd predominantly done that within the local authority enforced sector of health and safety legislation. HSE have their own enforcement responsibilities, largely in the manufacturing industries. And what we knew in Telford and Wrekin was that where we were seeing outbreaks, it was within HSE enforced premises, not local authority enforced premises. So we worked with HSE on a pilot. All the three major industrial estates, Stafford Park, Hollingswood and Halesfield, all the premises there were visited. We were able to give the HSE operatives that were going out public health messaging. In that time, we were very much pushing the twice weekly LFD testing, and they were giving those messages into the workplaces. And we know that this had an effect because workplaces actually contacted us on the back of the visit. The feedback that I've had from the HSE is that they found that by giving those public health messages, those local messages, it actually added legitimacy to the visits that they were doing, and they felt that businesses were more likely to engage because of the local tone. So the good news keeps and good work keeps on continuing with this slide. We've already talked about the communications and engagement. If I could just pick up with community resilience and support. Very early on, we started working with Dhsc and the Interfaith Council, recognising that we had communities where English wasn't the first language spoken, and wanting to make sure that we could get the correct COVID secure messaging out to those communities. Most recently, that work has continued with the Talking Heads videos and ensuring that we get effective vaccine uptake. Again, this is quite innovative, and when we're talking to colleagues around the Midlands, we were one of the first to do it. I think what we have in Telford in terms of our testing, we very quickly and early on said that we wanted testing sites, and we were able to secure multiple testing sites and multiple testing options across the borough, enabling our residents to have easy access to test facilities. But if I was to pick out one thing that we did where we actually went against the national trend, it was in early November, where we asked our residents to come forward to have precautionary testing if they'd got symptoms, say a sore throat, a cold, generally didn't feel under the weather. And I know from my work in the hub that this meant that we caught a lot of people that would have previously not known that they were COVID positive. So I think that that has really helped us with our management of the outbreak. And then lastly, vaccinations. Relatively new. to the whole outbreak control, but the work again that we've done in Telford and Wrekin to secure the vaccination sites and to make sure that we have got high percentages of our population moving into vaccination. We're now continuing work on looking at those hard to reach groups and understanding why we don't have vaccine uptake, and making sure again moving forward that we've got a high vaccine uptake. The DHSC's expectations of the local outbreak plan are contained on this slide. Many of the topic areas we covered in the June plan, but there are new topic areas that we were asked to cover for this review, including enforcement and compliance, vaccination, and variants of concern. And so from an outbreak control perspective, the variants of concern, we are asked to consider what our local response would be. At the moment, this is still very much PHE-led based on the genomic sequencing, but we have a robust plan in place in Telford and Wrekin should we be called upon to act on variants of concern. The tackling the enduring transmissions, we've done quite a bit of work on understanding our enduring transmissions. We've taken an intelligence-led approach, and we use the information that's coming through the DPH Power BI dashboard in terms of ward profiling and working with businesses, looking at occupations, looking at common exposures. But increasingly it is work about deprivation and understanding how COVID affects our vulnerable and underserved communities. And that's something that we're continuing to do with the refreshed local outbreak management plan. And again, as I've said previously, reducing inequalities around vaccination, understanding the barriers to uptake, that's an important part of moving forward in the Living with COVID agenda. So Liz, would you like to talk through the last slide?
Just to wrap up then, in terms of the region, also the Department of Health and Social Care also asked us to feed up key issues back up to national, to them through themselves to the national players. So in terms of the things we've fed back up, firstly, and Nikki can speak very well on this, is the COVID secure legislation, in the sense of some of it is only guidance and it's not statutory, so it's much harder to enforce and leads to confusion. So we do feel that they could strengthen the legislation in terms of that area, so it's easier for people to understand going forward. Funding, we have received multiple pieces of funding, but I think in terms of it's all temporary funding, and we need to be able to plan for the medium to longer term. So we need those funding pots to be consolidated into one. And then lastly, the national testing strategy. At the moment, we do lack a coherent national testing strategy. We are we've got lots of initiatives that have started, in very rapidly, and that is the nature of what happens during the pandemic. But I think this is the time for nationally to have a coherent plan so that we all understand what's expected going forward. I'll leave it there. Nikki, if you'd like to take down the presentation, and then we can take any questions.
Andy?
Yeah, thanks, Kelly. Really pleased to see this report. Going back to Liz's introduction to this, the kind of positive feedback we've had from this when it was submitted, it says a lot, I think, about how successfully we've come together to fight this challenge, and I mean not just across the council staff who've consolidated themselves into an effective team to do all that's been required, as Nikki has described, but also with our partners as well in the community, and that's been particularly important, as Nikki mentioned, in terms of some of the BAME communities and some of the more deprived communities in getting that message across and getting the importance of having the vaccination across to areas. I think going forward, it's going to be really important nationally that we get the balance between what the localities, the local authorities' role is in this, and the national system. That's but in terms of testing and tracing, and I don't believe that was ever right or ever clear right the way through this saga. I mean, from my point of view, you know, we ought to be managing this at a local level. Now, I mean, as Liz says to me, there are surges where we need help from the national system to cope with that. But it should be us using their help, not us having to try and sweep up after them, to put it crudely. And I think that's a lesson. I mean, we've shown ourselves the experts in this, and what I like about this plan is that it isn't just aspirations. It's all of it grounded in actions and things we've done and we know we can do, and it's based on a professionalism which I've pleased to witness as we've gone through this. But there's still huge challenges ahead as as Liz says, we need to manage this virus on a long-term basis, and it isn't going to go away, and we're going to have to make sure that we've got our systems right and our team strong enough to cope with that as we go forward. Thank you.
And Dave Evans.
Thank you, Kelly. In some ways, I'm going to pick up what Andy said. I'd like to say a huge thank you to the local authority and other partner agencies as well for the response to COVID over the last year. There were some very, very worrying moments early on in the pandemic. I was reflecting with a colleague this morning. It's only probably about 2 weeks after today that we were sitting down in a gold meeting reflecting, if the modelling came right, what would that mean in terms of ITU beds, our capacity in the 2 hospitals, etc. Now, fortunately, the modelling didn't prove to be as bad as that, but nonetheless, we've seen significant, huge demands on services, both in health and care and other public services over the past year, to which I think all agencies and partners have responded to magnificently, and I would genuinely like to thank all agencies publicly for that. Just also in terms of the vaccination programme, you know, we got off to a slow start. We always thought we were going to get off to a slow start, but working with partners, and again the council and other partners have stepped up and helped us considerably with this, particularly around TIC, but not just TIC. We are one of the leading systems across the country now in terms of vaccination. And just to put that into context, based on current vaccination rates, if we were to vaccinate 100% of cohorts 1 to 9, so that's everyone over 50 and the vulnerable groups, health and social care workers, etc., we only have about 7 days left to vaccinate. We've got about 30,000 people within all of those cohorts as a total, out of the number that we've had to vaccinate. You know, and if you think back to early January, I think it was the 9th of January, we'd vaccinated 11,000 people across the whole of Shropshire, Telford and Wrekin. We've now vaccinated over 270,000 people across the whole of Shropshire, Telford and Wrekin, and as I say, we've only got 30,000 across Shropshire, Telford and Wrekin if we could achieve 100%. And I suppose therefore I will say this because we are looking at the moment around capacity based on, we know there's going to be a reduction in vaccine supply over the next 4 weeks because of the challenges around vaccine coming out of India, particularly, and the shortage of vaccine coming out of India. I think it is likely, but a decision hasn't been made yet. I think it is likely that we will reduce the ability to book at the 3 vaccination centres across Shropshire, Telford and Wrekin for a short period during April. We will, of course, continue to give second doses, and we will, of course, vaccinate those people who've already booked into the programme. But otherwise, we're going to have a significant amount of capacity lying around or standing around with no one to vaccinate. Now, you know, the government's very clear and the NHS nationally is very clear. We don't want to move down the cohorts because we're worried about the supply chain issue. We don't want to bring forward second doses because we're worried about the supply chain issue. So realistically, reducing capacity at this stage is probably the only option on a temporary basis. I think we're likely to conclude discussions in the next 24 hours or so around that, but I just wanted to give a heads up because I didn't think it would be very helpful for me to sit here knowing we're having those discussions today and not inform the Health and Wellbeing Board. Thank you.
Liz, do you want to come back?
Yeah, I just wanted to come in on the back of that in terms of just come off a group that I chair around immunisation uptake and reducing inequalities. So I think actually I'm grateful to the NHS in terms of what we have got is a window of opportunity whilst the supply issues are here, is to really address those inequalities issues and do some really targeted immunisation work, engaging, understanding the hesitancy, and then if we can, immunising people closer in settings that are more comfortable to those individuals, and in a sense, let's use the time that has been given to us without planning to really try and close, and I love close that gap of those 30,000 people that haven't yet been immunised, to close that gap. Thank you.
Thank you. I've got Paul and then Karen. Thank you, Paul.
Yeah, thanks, Chair, and thank you, Nikki and Liz, for the presentation. I think it's really helpful. It's good to look back sometimes at that difficult journey we've had. I want to give a shout out to the third sector in Telford and Wrekin, because, to be honest, without them, we wouldn't have achieved what we've achieved here. And the partners we've got in both our community sector and our voluntary sector are hugely important to that Telford approach, that idea of Team Telford that works on difficult issues together and moves it forward. I just thinking about the vaccination programme, David, you spoke about that, and I know the number of volunteers who have been engaged in just being there at the centres to help people, to direct them, but also to act as a positive role model in terms of pushing forward the vaccination agenda in Telford and Wrekin. Really important for the future as well. But we wouldn't have done that, and we wouldn't have achieved that if it hadn't have been that Team Telford approach, which is all about voluntary and community sector and the statutory bodies working together. And I know it's part of our plan for the future in terms of our place-based approach and our ICS. But you know, let's learn those lessons from this experience and make sure that it isn't all top down, that it's bottom up and sideways as well. So thanks.
Couldn't agree more. Karen.
Thank you, Chair. Yeah, just a couple of questions. I don't know whether you want to answer as I go through, Liz. Just on page 32 and 33, which is actually page 10 and 11 on the report. You know, you did touch on the funding. I was just wondering, you know, you've got a comment, this funding will be used as far as it lasts, which I suppose is a bit of a concern. And about moving forward, there's going to be a core health protection team, and I must admit that I'm glad I haven't got your job at the moment. So, but I just wondered, that would be my first question. I mean, how are we going to know about, you know, how the figures stack up and what the government are going to do about, you know, keeping any fund stream coming through, so that, you know, we can stay on top of this, because obviously the Prime Minister keeps going on about possible third wave coming up on our shores, so it's obviously a concern.
So what I would say is that I've got a sustainable financial plan to continue with the core funding for the Health Protection Hub and other aspects of our work. So I, using the pots that have the temporary pots, but in a sense, we don't know how the infection is going to move forward, and that it was really just a marker in the sand in terms of if there are significant surges or third waves. Clearly, we would probably be needing to have another look at our resources. But at this point in time, I'm comfortable with the resources that I've got.
Okay. There's obviously a few little comments just about the HSC. I think the LFTs were great. The fact that we were on top of that, because obviously at the beginning in industry, they were finding a few hubs around where the virus was quite prominent in the manufacturing area. So I think that's absolutely great. Also, obviously, I think we all need to sing off the same hymn sheet, and it doesn't feel like that's happening throughout the whole country. And I'm glad that we're a little bit more advanced, and we were going against advice and the fact that we were doing the tests in November, so I'm really pleased about that. But the other, I mean, everyone else has said a lot of positive things, which I agree with, obviously. But the other thing is obviously you've also mentioned about targeting the areas where people aren't taking the uptake. I don't think it's just deprived areas. We certainly got one elderly gentleman that we see quite often when we walk in who actually is refusing to have anything, and he's got health issues, and we don't know why. I think some people have got things in their heads that there's a conspiracy, which is a bit worrying. But the other thing I wanted to know is on the data side of things on page 39, we're on about reducing inequalities. I just wondered how well it is working. You did mention a figure, but I just wondered how it is working in the ethnic minority groups, and also how we are going to monitor young people going back to school, how the lateral flows are going with those, and what the figures are going to look like when they break up for the Easter holidays, what our figures might be, if we've got any indication of that at all.
Okay, so in terms of monitoring uptake, so I am monitoring uptake geographically in terms of uptake of immunisation, and that's how we will target, and clearly we know where our deprived and BAME communities reside. So we've got that picture and we're working on it. But you mentioned individuals, and so please rest assured that we're also looking at that individual level basis, at an individual level, to encourage clinicians or even care home managers or whoever to have individual conversations with people that are reluctant to be immunised, to understand what their reluctance is, to bust any myths if that's what's coming forward, and to try and give them more confidence. So it's a two-pronged approach. It is about thinking about communities and particular groups that are less likely to come forward, but also thinking about the individuals as well. So two-pronged approach. In terms of schools, we are monitoring as best we can in terms of the LFD testing that's taking place. Nikki has a very good relationship. Each hub member has a relationship with a set of schools, and so we tend to work alongside the schools quite well in that respect. And I think there was a third question, and I've forgotten what the third question is. Apologies. Was there a third one? Or did I wrap?
I probably forgot myself.
Oh, well, I think if Karen, if there's something further, drop me an email, and I'll be more than happy to respond. But I think that was my response to that.
Can I just say it's not really. I think. I mean, I'm just going to make a bit of a criticism. I don't think it was just at us. I think it was globally. I think lessons learnt, definitely. The fact that we weren't, as a country, quick enough to help our local communities. Certainly, we set something up where I live in 4 ward areas to help with prescriptions and with shopping. Still doing it now, but I just think that it's a lessons learned that you know, now something awful like this has happened. The fact that I think we'll be a little bit more astute and be a bit quicker in trying to contact people in the community to get people involved. There was lots of problems, I think, with the volunteering system. I knew lots of people who were volunteering right at the beginning when Telford and Wrekin did send the letters out, but weren't getting contacted. And I just think that it was such a big thing, and you know, to happen and try and get things organised from day one. I just think now something like this has happened, I think you're always going to be able to get certain things in place. So it's mainly just a bit of a comment, the fact that I don't think it's just the Telford and Wrekin, I think it was the whole country that just weren't quick enough to be able to respond to help those people who couldn't get out, who had health issues. And I just think that, you know, we hopefully have got that data now to be able to help. So, but otherwise, I think as an authority, I think we're doing exceptionally well.
Thank you, Barry, and then we'll move on to the vote, I think.
Just a short statement that Health Watch Telford and Wrekin are currently in, and we will give the responses to Liz and her team. We're looking at hesitant and reluctant vaccine takers, and we're doing a share in your view, trying to ascertain why they're reluctant and what reassurances they would need to change their minds. So we're doing it like a hot topic thing through the press, short and sharp, and we'll give Liz the comments that we received back.
Thank you. Great. Okay, so we're going to approve this. So if you just want to say if you don't approve, I think that'll be easier, and we'll take quiet as an approval. Everybody happy? Yeah, okay. That's approved, thank you. Item agenda 6, you'll note there's not a report. It's going to be a verbal and a video presentation by Michael Bennett.
Good afternoon. Thank you. I think I'm talking about the Independent Living Centre, and I think just in terms of context before the video, this has been funded by Telford and Wrekin Council and developed in partnership with CVS. It's based in the town centre in Hazeltine House. I think it's fairly long overdue. It was original discussion started about 5 years ago about the ALC, and it was commissioned last year, delayed because of COVID. But the intention is we have a soft launch from next month, and we're starting some communications around this. And part of that is using videos to promote the service. And hopefully this video will give a good context of what it is and answer some of the questions that you may have, and I'll answer further questions. And what I'd like to do then is show you a short, give you a brief demonstration of a virtual house that we've used and developed as part of a sort of a combined digital and face-to-face offer that we'll do in the ILC. If that's okay, Joseph, could you show the video, please?
Yes, of course.
Thank you.
Is that coming through on everyone's screen?
Can see it, yep.
Okay.
Oh dear.
Do let me know. I have clicked so the sound will come on, but do let me know if there are any issues.
Where's my dinner?
Andy Burford. I'm the Cabinet Member for Health and Social Care, and we're here today at the newly opened Independent Living Centre at the town centre in Telford. A really exciting and innovative project that we're pleased to launch today. It's for people of all ages and abilities. It used to be aids and adaptations. Well, this centre goes well beyond that. We now have all sorts of devices and means to assist people to live independently and well at home, which was one of our primary aims as a council in terms of our objectives. We're delighted with this centre. It offers us the means to show people for real what the adaptations can do for them in their own homes. We've got it set up. I'm sitting here in the kitchen, and you can see that this is designed to mimic the situation at home, so that anything we try that will help them in that setting is done in its natural environment, and they can feel comfortable with that and know that they can go away and use it. I think the second principle really of the way we operate this centre is that we're doing it in partnership. We're doing it with our voluntary sector partners, which is one of our strengths in Telford and Wrekin. We work very well and closely together, and the local CVS are working with us on this and helping us to manage this building, which is great. So for both those reasons, we're really pleased to be launching this project today. Thank you.
Hello there, my name's Sarah Dillon. I'm the Director of Adult Social Care at Telford and Wrekin Council, and I'm here today in our new Independent Living Centre in the centre of Telford town. Getting the best for our Telford and Wrekin residents, that's the right support at the right time, is what we really care about in adult social care. Telford and Wrekin Independent Living Centre complements our existing services supporting the borough communities with a new innovative approach by bringing together in one place advice, information and equipment for everyone's independent living needs. This centre where I am today is in physical form, where appointments can be booked and we can see people face to face. But we've also got available our virtual centre, which can be accessed on the council's website. Through the virtual centre, we want to be leading the way with digital access. It's easy to navigate, and it gives people the opportunity 24 hours a day from the comfort of their own home, access to look at useful aids and gadgets that can be used within a family setting or in a loved one's home to keep them as independent as possible. We couldn't have launched Telford and Wrekin's Independent Living Centre without our key partners, and it's a massive thank you to Telford and Wrekin CVS, who are joint leads on this project, offering both preventative and responsive support to individuals in relation to all things independent living. Thank you also to all our other community partners for making the Independent Living Centre such an invaluable community resource for the entire community, whether you're younger or older. There's something here for all of us.
It's great to have been working together with partners and experts by experience to develop our Independent Living Centre. Together we want to provide information, advice and guidance to the customer alongside formal assessment where required. Our approach is to find community solutions to address people's needs. We're excited to welcome people through the door with appointments, but also people passing by who require expert and friendly advice and support. And to be jointly working in partnership across the community and voluntary sector and statutory colleagues, we can create a seamless whole family response to need. We want to create a relaxed space for peer support. Often our families and their family carers learn from each other and share tips of support, but also just to know they're not alone.
Welcome to the Independent Living Centre. This has been developed by Telford and Wrekin Council, T&W CVS and Experts by Experience as a partnership. The ILC is specially designed to provide advice and information, access aids, adaptations, equipment and assessment in order to remain independent at home. It's also a resource for the local community to use for meetings and support groups. The ILC is an important part of Adult Social Care's Live Well Telford offer, provided in an accessible town centre location.
Welcome inside. I'd like to show you our main reception area. This is where we will be showcasing all of our gizmos and gadgets, little things that will just make things a bit easier at home and enable people to remain that little bit more independent. We have some more of our things that people can try and see if it's what you need to meet your needs. Over here we have a stair lift and stairs. which will enable you to have a full assessment to see whether this is what you need at home. This area also lends itself to the community, and we will be able to host events to promote what's happening here in Telford. We'd also like to have, and we will be having, our experts by experience here, who will be able to demonstrate and talk about those things that they use themselves and give you direct advice. On from that, we have our sensory team, who will be able to give you the correct advice around hearing and sight loss.
Over here we have 2 rooms where we can have a private conversation with you. This room in particular is for us or our experts by experience to have a chat with you about sensory loss, whether you've got a vision loss, a hearing loss or a dual sensory impairment. This room will be fully equipped for us to have a conversation with you about equipment, strategies that can help to meet your needs. This room and the reception area has a loop system for those people that need it. And then from here we've got the Welcome to Chat corner, and from here you can see over to the kitchen and dining room area.
When we were developing the Independent Living Centre, we decided it was really important to replicate people's homes so that we could do an assessment in our centre without having to visit somebody's home. So here we have recreated a kitchen area as it might be at somebody's home, with wheelchair access and with equipment and adaptations that we would look to provide you. We've done a similar thing in our other 2 rooms for assessment. On this side we have a bathroom with a bath, a toilet and a sink where we can assess you for your bathing, toileting needs with various pieces of equipment and aids. On this side we have a bedroom where we've got a bed where we can assess your transfers in and out of bed. We have a chair where we can assess your seating transfers, a commode and various dressing aids that you can try at the centre to see if they're helpful for self-purchase.
Thanks, Joseph. Just wonder if there's any questions before I sort of move on and look at the virtual tour.
Hello.
Sorry, Karen.
Hiya. Yeah, not so much a question, just I think it's brilliant because having gone through these, probably 5 times now with relatives, I think it's really good. We had to, I think we got the pebble for one relative from the Citizen Advice Bureau. They had people that used to go certain days of the week to take certain equipment that you could see and would be helpful. So we bought something called a pebble that we always knew Bill's auntie went out in a handbag, so we attached the pebble to the handbag so we could ring fence it, and we knew when she was going out the house. So when we knew when she was going 30 miles an hour, we knew she was on a bus. I mean, we can all laugh and joke about that, but we used to have to get the police to bring her back home again. So we were floundering about help, aids, adaptations, particularly in a different authority. So I think it's really good because I don't think people realise what is out there for people to have. And if you haven't got experience in the past, you flounder, you don't know how to get some of these equipment. Years ago, you used to be able to borrow things from like the Red Cross used to be able to borrow like wheelchairs or toilet seats and things like that. You can't get things like that nowadays. So I do think that to let people know what's out there and what aids are available, I think is absolutely excellent.
Thank you. And I think what we've wanted to do with this, with the IRC, is to have a place where people can go and look and see and touch and feel and pick up and look at. But because of COVID, we also realised we needed to strengthen the digital virtual platform, and I think that's why we created the virtual house. So what you see in the building and the equipment that and aids and adaptations that are sort of set on the shelves, set in the context of different rooms. We've also been able to create that as a virtual, so people can see that as well.
Sorry, me again. Sorry. Yeah, I assume then if people haven't got families, say for instance someone's been in hospital and they come out and they, you know, you have to make sure things are in place for them. I just wondered how that would work. And you know, a lot of old people that I know don't have computers, wouldn't know how to use them. So I assume then a social worker would do a virtual tour.
Yes, we would, and again from the hospital perspective, a lot of the issues around AIDS adaptations are considered at the point of discharge and through the point of enablement as well. What we've also created is part of our Pathway Zero offer. People can link into this unit when it's set up, because we'll have not only the OT assessments here and the sensory assessments, we'll also be having the booked appointments. So the locality workers can book people in, or the hospital team can book people into this to have that early conversation, as well as the virtual tour. Virtual house is a public facing tool. I'll show you that in just a second after the questions. But that is very much an interactive tool that public can look at through We Live Well Telford, and workers will be able to use it as part of that assessment discussion about early help and things that might help.
Thanks, Chair. Thank you, Michael. Really positive presentation, and really good to see it. I've worked closely with a former cabinet hat on with the experts by experience, and know their skills, their knowledge and their experience, and how helpful that will be to people in Telford and Wrekin. There's nothing like speaking to people who have had to go through some of the issues that you're going through for the first time. And those trusted partners are there, and I'm so glad it's in the centre of Telford, one bus ride away from it, where it was 2 buses away, and I think that's really important. I think it's really a positive step forward, and I'm really pleased. And again, without the partnership with our voluntary sector, we wouldn't be able to do stuff like this. And it's great that we are working together to find different ways of working and different ways of approaching things. Thank you, Michael.
Okay. What I'd like to do then is just give you a brief demonstration of the virtual house. If I could share my screen. I've just got to find it. Just trying to, there it is. Can you all see that?
Yeah.
Okay. So when you open the screen, when you open, this is what you see at the beginning. So this is basically a house. Each of the red spots is what we call a hotspot, and that gives a picture and a explanation of what each item is. And so you're able to navigate, and I'm doing this on a touch screen. It works very well with a mobile phone, so you can walk through the house into different rooms, scan the room, and if you see particular items, you can click on it and see what it is with the description. What you also have is different ways of scanning the room, or scanning different rooms. And so you have a bar underneath where it can help you to look at a room of your choice. And again, you can navigate the room, look at different items, and the items here are around visual impairment, hearing impairment, memory, items for each room. It's equipment that really simple aids and adaptations, such as the tactile bands. And these may be utilised for instead of a label for somebody who's partially sighted. And it would you would then understand what that item is that you're using. We've got the occupational therapy equipment, such as the stools, and what we can do is go again, scan across to different rooms, walk upstairs, and then go into again a different room that you care to choose to go into. And what we'll have in this room, again, we'll have different items set out. This is an epilepty bed sensor in this room. And again, that's just a piece of equipment that will alert somebody else in the house about the potential of a seizure. We could go into a different room. And you'll see simple equipment like a leg raiser or a sensor motion sensor that's here as well. So again, somebody gets off their bed and this will give an alert to another family member. So this takes you through different rooms. So we've got bathrooms, so we've got bath aids in here as well. So you'll see the bath seat, you'll see in the shower room, there's equipment in there as well. And again, all of it is explained what each item is. What we also intend to do is to create it as a directory. So not only can you look at it through this technology, we'll have a separate directory created as well. I just wanted to show that so that you have a sense of what that looks like as well. I don't know if there are any other questions.
No questions?
I just want to say, I mean, I think that's a really impressive little demonstration, Michael, and it's, I mean, what I also like is when you get a description of a bit of equipment, you can, if you decide it's for you after reading it, you can go straight to the supplier, you know, so it's a seamless way of getting hold of the thing that you want. So I think it's brilliant, you know, and you know, for some people it'll be a real boon to be able to do it in that way. Not everyone will, of course. You know, others will prefer the what you get from the visit to the centre rather than doing it in that way. But for a lot of people, that's going to be a terrific help, I think.
I think so. And we created this, and I think we'd looked at other providers that had done something similar and really weren't happy with its interactivity and how it was designed, and asking internally, this is using the technology from Housing 50, and we asked some housing provider to use their show home so we could put everything in situ, and then create the narrative really clearly, so it very much is a one-stop shop. And we've shown some other providers, and they already are saying, can we have it, can we buy it? So others are recognising it, and the National Technology Enabled Care Association are really impressed with this because there isn't something like it elsewhere.
Barry? Are you on mute, Barry?
Ben?
Yeah.
Just like to congratulate Sarah, Michael, Debbie, and all the teams that have been involved in bringing this to fruition. As the ex-chair of the Carers Partnership Board, we've been involved in lots of discussions over the year, and it'll be an excellent facility for encouraging people with abilities to be more independent, but also carers that need assistance to care for people within their homes, which it'll be an asset. It'll be a godsend for carers. So thank you for all the work you've done. Really needed, and well done.
Thank you.
Thank you. Okay. Is that your presentation done, Michael?
Yes, that's fine. Thank you.
Checking I weren't putting you off when you were going to say.
No, that's fine. Thanks.
Thank you so much. Item agenda 7 is for noting, and it's the housing allocation policy by Tony Guest. Thank you.
Good afternoon, everyone. Thank you for inviting me. We're here to talk about the allocations policy. I think probably all know and agree that a decent home is the foundation in which people build their lives, and it's fundamental for everyone to achieve positive health and well-being and outcomes. And without a roof over your head, people are often prohibited from accessing wider services, including employment, education, and just general opportunities really to improve their lives. So this report brings forward and introduces our draft version of the Council's revised housing allocation policy. The policy is a legal document, it's a legal requirement for the Council to work with local housing associations and to influence how they allocate their homes within the borough. It also includes a tenancy strategy and also the way forward within Telford and Wrekin with the housing associations, how we will nominate clients for the social housing properties. It is important to note, though, that while housing associations must have regard to the policy and the tenancy strategy, they will, alongside this, have their own allocations policy. So our own document is an overarching policy that the housing associations have to take regard to, but they will have their own individual policies. Just to note that the draft policy is now going out to partners and stakeholders for consultation. It's an 8-week consultation period, so if there's any partners around the screen today that would like to obviously have access to the policy and make comments, please email me and I can make sure that you're put on that list, and having feedback into that consultation would be really key. Also, alongside that, as you'll be aware, we don't have our own stock of houses. We're not a stockholding authority, and we don't operate a housing waiting list or a housing register within the borough. What we do as a local authority, along with partners, is provide advice to clients who are either homeless or likely to be homeless within 56 days underneath the Homeless Reduction Act. So we provide that advice and assistance to ensure that people have got access to that right advice and know what their housing options are in the borough. There are changes that's coming afoot as of this week around the current way that people access registered social housing. And alongside that, what we've done is produce a new website that shows all the registered providers that are operating in the borough and shows that true pen portrait of the larger associations who are operating in the borough, where their properties are, the types of properties they've got, and roughly the number of voids they've got on an annual basis. And that website is now live on Telford and Wrekin Council's webpage. And like I say, that demonstrates and has the right links to how people can access those properties as well. In a nutshell, that's it. The allocation policy is showing those specific groups of people who we would like the housing associations to prioritise in terms of their higher bands and how they would allocate their properties. And it looks at various different elements, from people with disabilities to families to vulnerabilities, and that they would prioritise those, and also the regional preference group of those people who are within other specific categories. It is in the full document, which I did supply with the report, so the report outlines it, but then there is the full allocations policy alongside that you can look at. And obviously, like I say, it is draft and it's now out for consultation for 8 weeks for people to comment on. The overall recommendations, though, is for the board just to review the allocation policy and the consultation, and knowing that it's now open, and if any partners and stakeholders would like to be part of that, to let me know. Also to note the nominations and tenancy strategy within the overall allocations policy, and also note the changes of how local residents can access now the registered housing providers within the borough.
Thank you. Has anybody got any comments or questions? Karen?
Sorry, me again. Hi, Tony. Thanks very much. I'll probably ask questions. I have read the report, but I'll probably ask things that you think, oh, it's already in the report. So apologies if I haven't taken it all in. Think I'm getting brain addled at the moment. The system worked on a point system a while ago. I'm just wondering how that's going to work now. So when residents go into the new system, they have to choose which agency they're going to go with, I assume. And I just wondered how that's going to work. So would they be able to apply to several agencies, or do they have to have a point system from their GPs or anything like that? I just wondered how it's going to work.
No, so it's going to be very, very different. As you might be aware, previously there was two ways that, or fundamentally two ways to how local residents could access, and that was through either the Wrekin Housing Group direct themselves or Homes Direct. Yeah. It's Homes Direct who have made the decision to close their system, and that is what's known as a typical choice-based letting system, where, as you say, people get put in points or banned in areas, and that has now gone. So there will no longer be that function within Telford and Wrekin housing associations of that bandings. Some of the individual partners either are now or will be potentially operating their own banding system, but again, that will be when you link into those individual RSL's websites that will tell you if they are holding the band. Some are not. Some will only be taking nominations, or for those elements that they aren't going in through nominations, maybe advertising their properties on a wider platform. So it is very different in terms of the way people allocate. They will be having to go to individual registered providers and registering potentially with several. But what that hopefully will do is, A, they'll potentially get more options. What we've tried to do within that pen portrait is to show the reality of how many properties are coming up each year. Because I think what we've had historically is a high number, going back in the day, a high number of people registered on a typical housing register. For example, 16,000 we used to have on that register, with really only about 1,000 properties coming up every year. So what that did was people thought they'd got to the top of a list, but there's actually never ever a top of a list. And so it was trying to give that reality that this is the true picture in terms of the likelihood within that area of property coming available. And certainly when people want specific areas, if they can see that actually that registered provider hasn't even got properties in that area, it gives them that true picture. So I've done a bit of a long-winded answer there, sorry Karen, but ultimately there will be multiple platforms for people to be able to allocate on, and there won't be pointing or banding within a single waiting list. But it may be that with a registered housing provider, they may have that within their element. They will be looking at their housing need fundamentally.
So really what we're trying to say then, it's probably going to be a simpler system and an easy system for people to see that they're not actually going to be at the top of the list if they're with several providers. My other concern would be then is if different providers have got different rules, there may be, I presume we'll have people helping them by saying, one provider might say, oh, we have a point system, but we do it this way. And another provider say, well, we have a point system, but it's totally different to the other one. So I assume we're going to have officers helping with that sort of, but I mean, it's at early stages, yes, isn't it? So
it is very early stages. And because what we're doing is signposting residents to that individual RSL website, that individual RSL website will have their own allocation policy on there. So they should be able to see then, am I likely to be accepted? Have I got significant rent arrears? That means they won't even accept me. So again, this is down to the individual registered providers to advertise on their own website. These are my policies. So as I said, as is the overarching allocations, each one will have their own allocation policy behind that. And they need to look at both of those elements really, because we may say as a local authority, we want the RSL to take a reference from ours, but the ROMAR might say we will not accept people who've got significant rent arrears or over, and it could be 2,000, it could be 1,000, it will depend between each RSL, and that happens now, but it probably isn't spelled out quite as clearly when you've got a choice-based letting system. But by signposting to people individually to their individual RSL website, hopefully that will then give that true picture of this RSL will take this element, but this one won't take that. So it's going to mean clients have got more access points to go to, but hopefully that true picture, because the one size doesn't fit all in terms of the old one CBL system.
Yeah. I mean, I think I was a bit alarmed that when they were going to withdraw, but I think, you know, from reading, it looks like it will be better. And I'm glad you brought that up, because on page 72, you know, you mentioned about a council's able to nominate housing, but some people might refuse. So obviously you've touched on that, because obviously if these people owe so much money, we can't just say, well, we're not going to house you anywhere because you know you're a bad debtor, and you know we're not going to bother. The other thing I suppose I'm a bit concerned about is you know, like with universal credit, you know, the way the system worked before, people like with my sister-in-law, the housing benefit gets paid directly to the landlord, and she's actually been able to skip past that. They haven't quite caught up with her now. She's on a pension now, so we've now been able to change that over. She's got slight learning problems and that, but so I just wondered what was going to happen with the system. I mean, I suppose that is a government thing. Is it can people choose whether it goes direct to the landlord rather than, you know, the way it was before?
I'm not going to sit here and say I'm an expert in benefits. That'd be wrong of me, Karen, but you can definitely request it. And in fact, it's down to the tenant to request and approve that. So a landlord would have to have real special circumstances to demand it coming direct to the landlord. It's got to be client consent, and if the client doesn't consent, it can't. But as a client, a tenant, I suppose, you can request that to go direct to the landlord, so you don't even get involved in that. So that, but that's a benefit. That's universal credit and DW.
Yeah, I just think that to be honest, for some people, I think it's the best route really, because then they don't get tempted to spend it on other things and end up being a bad debtor and possibly lose their home. The other thing was, I think that's pretty much it really, Tony. I get concerned about some of the HMOs and sharing facilities, you know, in the past. I'm just trying to go through my notes. I've highlighted on pages, so I do apologise. Yeah, no, I think it was just, I mean, I don't think that's much we can do anything about, but certainly some people who have to share kitchens, they get food stolen, or they get a bit frightened to come out of their room. So sometimes I get a little bit concerned about some of those facilities that are out there, really.
And yeah, we know HMOs serve a real good purpose because of the local housing allowance, and unfortunately some clients are only entitled to that element, so they serve a really, really good purpose, but we're also aware of some of the pitfalls of it as well.
Thank you.
Thanks very much. Thank you.
There are some also very good HMOs, I have to say, and there are workers making sure their sandwiches are safe, I'm sure. But, but I just thought I'd get that.
Sorry, Che, it wasn't a generalisation. You know, we've you know, I've had people complain. It's only obviously a handful, but you do get concerned. That's all. You know, so
get that. Thank you, Tony. If there's no more questions, thank you very much.
Thank you.
Item agenda 8 is partnership COVID-19 community support response. For Louise Mills. Thank you.
Thank you. Hi everyone. I guess so as an agenda item in the report, this follows very nicely on from Nikki's earlier presentation in terms of some of the work that's been happening to support people during the pandemic. So I guess with the lockdown restrictions easing, it just felt timely to kind of bring a report in terms of the community support and the work of the council with partners. And the support we've provided, you know, a great opportunity to kind of take stock and think about next steps and to be able to share those with board members. So as summarised in the report, you will see that in terms of the support, it was largely through establishing a community support helpline. We mobilised a team of council staff who were redeployed into roles to very much provide, I guess, direct support to the phone calls that were coming in, so very much a team of responders. And then we had a network of community and voluntary sector partners and volunteers working incredibly hard on the ground to put some real crucial support into some of our most vulnerable residents. The report summarises some of the support that we were providing, so it was largely around access to food, supporting people with prescription collections, and I think probably what was really key was providing support to some of those vulnerable people that just hadn't got any family, friends or social networks at what was a really difficult time. So safe and well visits and being able to provide keeping in touch calls for some of those residents. Some of that probably sounds quite simple in terms of support, but I you know, some of the complexity of some of the cases that our teams were having to support, you know, I can't underestimate that you know, people have had a really difficult time. I think the report highlights a number of achievements in terms of what we've achieved with partners and the timely support that we've been able to deliver. And I think, just to echo, I guess, some of the fantastic comments that have already been made by board members, the community and voluntary sector in terms of the flexibility and how they were able to adapt to a constantly changing picture of what support was needed. I think it just shows a true testimony to the voluntary sector and the partners that we have, but also the foundations of what we've got in Telford and Wrekin. I think we can be extremely proud, because if we hadn't got those foundations of years and years of working with some of those partners, we wouldn't have been able to deliver what we did, you know, so quickly and at pace and at the scale. So probably I guess the bit to highlight on, given the time, is just around where we go next, really. And I guess just to build on some of the points that both Andy and Paul made earlier, the next steps and some of the service developments and the initiatives that I've highlighted in the report are very much things that have evolved naturally from some of the partnerships and some of the work that's happened. So very much bottom up, some of those needs that we've really identified, and areas of work that we now want to take forward. So obviously loneliness and isolation, that isn't going to go away for many of our residents when the pandemic kind of goes, or the lockdown restrictions ease. We will still have a large number of residents that need support. So we're continuing to work with the voluntary sector and organisations to continue to provide that support, which is going to be really important. And what we've tried to do is lots of engagement with some of those residents to help understand what would help them connect better with community support, what are some of those activities that they might be interested in. And we'll be looking to work with some of our community practitioners and our community development workers to look at how we can provide some of that support going forward. We've already touched on in earlier points in this meeting about the importance of volunteers. And it's great news that we've received some grant funding to be able to continue to develop that network of community champions. So that's just fantastic. Nikki in her presentation talked about some of the great work of the Interfaith Council. And again, they've been a real critical partner, particularly in terms of support out of hours. So the work with them will be ongoing. And they're obviously particularly important in terms of engagement and communication with our BAME community. And probably the only other sort of initiative just to highlight, because it's another great initiative, is as part of our Holiday Activity and Eat Well programme, which was a well-established programme pre-COVID, pre-pandemic. We continue to deliver that support to children and families throughout. And we've received some funding from Department of Education to extend that provision, which is really great. So we'll be launching some further activity and support starting from the Easter holidays. But hopefully the report covers the main points. So happy to take any questions. Thank you.
Thank you. Anybody got any questions or comments? No. Oh, Andy.
Yeah, only to say that this, as Louise says, this complements the early report very well. I mean, we've had really good feedback from residents. That's the point to say about the way we've supported our communities and individuals in our communities, and I mean, I think this report really shows why we've had that kind of feedback. You know, we've been thorough and we've been extensive in the kind of support we've offered, and we've got a sight on where we're going in terms of what we need to do in the future. So it's an excellent all round, I think. Thank you.
Karen?
Yeah, no, I think it is really good. But again, from what I said when Liz was on earlier on, I just think that we were slow to react initially because we had to set up something locally in our community before we did anything as a council. So but I think this was countrywide. I don't just think it was our authority, but obviously when we started getting into this, I think it was quite good. But I just think that lessons learned, that I don't think we were quick enough.
I think, can I just respond to that? Is that okay? I think one of the challenges, Karen, was around, it was trying to understand what support was going. We didn't, obviously, we wanted to use resources, I guess, in the best possible way. And it was quite difficult to navigate a really complex national system at the time of the NHS responder scheme, the volunteer scheme, what support was coming from elsewhere. So I think it was trying to strike a balance between where the council needed to provide some support in terms of almost filling that gap in terms of need, but not wanting to then duplicate maybe efforts and the resources that were going to be provided elsewhere, just to make sure we use our resources in the most effective way. But completely, yeah. But for an officer, I guess, that was kind of in the mix of it all, in the scale of what we had to do, I do feel that it felt like me that we did deliver and mobilise very quickly. Yeah, but I hear your point.
Thank you, Andy.
Yeah, I
actually was trying to come back on that, Chair. I put my hand up before, Andy. Can I just come back to that?
Okay, yeah, go on.
Sorry, Andy.
Yeah.
No, I mean, it's not, I mean, I think we've done a great job. It was just the fact that I think it was just lessons learned. And you are right. We had lots of people who were volunteering on the general website, and no one was contacting. It wasn't our website. It was just trying for everybody to try and link all the services together. So I can understand where you're coming from. You know, if you've got lots of people volunteering on different sites and then no one collates it and brings it all together to signpost them, then obviously it didn't really work. We had lots of friends who went on the national one, wasn't working. So then we did something locally because obviously people were struggling. But I mean, otherwise, when we did get mobilised, and obviously lots of officers did, I mean, it worked extremely well. But I mean, I just think that initially it was quite slow.
Yeah.
Okay. Thank you, Andy.
Yeah, I want to avoid being defensive here because I mean, I know it wasn't, you're not intending, you know, to criticise in that sense, Karen. So I appreciate that. But I will say this. I think, in terms of our speed of a response as a council, it was second to none. We were on this within hours, within days of it being needed. Now, I mean, I think where you're right, Karen, is that there was a lot of people wanting to volunteer and help very quickly. So I think the fact that we've got those, we're in touch with those volunteers now, means that we can be even better prepared in future to coordinate things and to help with that coordination. And I also think you're right in terms of the confusion over national attempts to engender volunteering alongside our better placed attempts to coordinate volunteering at a local level. But I will say, in terms of the overall local authority response, and I've got no apologies for banging the drum here. We were and it was acknowledged, we were ahead of the game right from the start. So I think, yes, there's always lessons, but I mean, I think we've done pretty well considering.
Thank you, Paul.
Yeah, I just wanted to echo what Andy's just said. You know, I mean, if you're criticising the centralised approach, then I can accept that. We were off the mark immediately in terms of the processes in Telford and Wrekin. We delivered 50,000 free school meal parcels to children who wouldn't have been fed in those early weeks if the government system was relied on. You know, that doesn't happen. That doesn't happen without a huge amount of work and organising and developing. So, I mean, I think it's harsh criticism of Telford and Wrekin, Karen, that you're giving there. I mean, it's very clear for me and from my local area in Madeley and Sutton Hill that I knew exactly how to get support to people and how to direct them to the right people at the right time. But if you're emphasising the central attempts to control everything, then yes, I agree with you totally.
Karen?
Yeah, it's just an observation, the fact that if we hadn't done anything within 4 wards where I live locally, there was a lot of people who couldn't get the shopping or prescriptions from day one, really. So it was really that. I mean, I did say eventually that, you know, as an authority, I'm not actually criticising staff. Certainly the general government weren't sharing the information because, as I said, there's lots of people I knew who were volunteering, didn't get anything back at all. So it was from the government system and the NHS, which is a bit of a shame, really, that it wasn't all collated together. But certainly as a local community, I think, you know, you were on about Team Telford. Obviously, it's Telford and Wrekin, you said earlier on. But certainly the local volunteers here, even though we support 4 wards, they go to Team Shorebirch because everybody here has supported 4 different areas. And are still doing that now, but certainly at day one, I think it's very difficult. And as I said, I think it's lessons learned, and let's hope nothing happens like this again in future. But I think you know the reaction was good, but obviously there was people left. But certainly as an authority, we have worked well. And certainly my mum, who lives up a mountain in Wales, she hasn't got support. So if I don't do it over the internet or get neighbours to help, she's absolutely stuck. So certainly there's lesson to be learned in other authorities. So it's just an observation from the beginning. But otherwise, I think the officers have done a great job.
Thank you. I'd like to echo that. I think everybody's done an amazing job in the whole council, and the officers and the staff and everybody involved, haven't they? It's been fantastic. Thank you so much. There's no more questions, so we'll thank you.
Right, thank you.
Item agenda 9, Shropshire and Telford and Wrekin Sustainability and Transformation Partnership Update. That's a mouthful, isn't it? Nikki O'Connor, thank you.
Thank you. Yes, it is a mouthful. We'll be changing the acronym shortly, which I'm really pleased to hear. So I have a very short presentation, and it literally is very short, sort of conscious of time. I'm sort of looking at Joseph. Do I need to load this up, Joseph, or have you got it?
I do have a copy of it. I'm happy to share my screen for you, or you're
Would you mind that? Would just be helpful. It'll only be
course.
And part of the presentation just reflects upon our vaccination position, which Dave Evans knows a lot more about than I do. So I'll invite Dave if he wants to make any additional comments when we get to that point to what he's already said. And I've been reflecting through the course of the meeting just how many times people have mentioned the word partnerships, which is really positive, really positive. And how what we are trying to do here, albeit this is a sort of nationally mandated process, is actually the value of it is around bringing the voluntary sector, community services, local authority services and the NHS together. And tragic though some of the circumstances have been around COVID, as we were reflecting on in the earlier part of the meeting, one of the advantages has been that it has brought us closer together, I think, in terms of providing services, thinking how we can do things in a more joined up way, thinking about how we can do things quickly. The NHS is not renowned for doing things quickly. We might do things thoroughly, but not necessarily quickly. And working across the breadth of our services has really had some benefits. Could you go on the next slide, Joseph? So bit of process stuff really, as much as anything else. So from April, so next week, integrated care systems are intended to cover the whole of the country, and they've grown out of the sustainability and transformation partnerships. So we'll be changing our acronym from STP to ICS from next week onwards. This has come out of it came out of a policy statement set out in the NHS long-term plan, but it really came out of what was happening in local places. about where people were seeing the value of working together rather than working as separate statutory organisations. So a white paper has been published. I believe it's due to start going through its parliamentary processes sort of from next month onwards, but it gives the legislative backing, I suppose, to give us the statutory wherewithal to create our integrated care system, and that's not the most important thing to the public, of course. That's not the thing they're going to be interested in. What they're interested in is how is it going to make a difference to me and my family and the services that I get. But the purpose of the legislation, I suppose, is to remove some of the barriers that have been there to working more closely together. Certainly from an NHS perspective, we've had a complexity of legislation since sort of 2012 that hasn't always helped. And I think the purpose of this white paper is to sort of unpick some of that and try and make things a bit simpler. So it's, as it says on there, so some of it is about removing some of the barriers to help us work together, and some of it is just to reduce some of that former bureaucracy that has been there. But the focus is really about population health and how we can join together locally to think truly about the needs of the population and what resources we can put jointly towards meeting those needs, and also to make us more responsive to the population in a more joined up way than perhaps is there at the moment. Could you go on to the next one, Joseph? It says there we're on track, and actually we've been approved. So as of the 1st of April, we become an integrated care system. We are probably one of the smallest in the country, but we are hoping to take that as an advantage rather than a disadvantage, because it does mean that we haven't got multiple organisations to work across and within. It's a fairly small group of people that we're talking to, and hopefully it does mean that we can do things more effectively. Those people who come to the ICS board will know that we put forward in our application process 10 pledges, which are listed there. And some of them would seem very NHS orientated. So, improving the quality and safety of our services. Obviously, there's been a history in the area, but we're beginning to make traction, I think, on that. Integrating services at place and neighbourhood level speaks really to the advantages here. And I know we're going to be coming to that in the next item, but Telford and Wrekin particularly have made good strides in this. There's been really good progress made. We do want to tackle the problems of ill health and health inequalities, and we talked about that earlier on, didn't we, in terms of vaccination programmes and how we're getting services to the right people in some of the later items we've talked about. We know we need to improve mental health, a learning disability provision, and there's a whole action plan and resources allocated to that. And then the next two pledges around economic regeneration and climate change. I suppose it'd be interesting to reflect, would we have had those in there a year ago? They are far-reaching long-term aims, these two, and they will very much be led by the local authorities, but with other partners' input to those, and they are very important things, and certainly things that are dear to my heart. Leadership and governance, never the most exciting thing, again, from a public perspective, but we do need to have the right framework in which we can operate, and hence the reason that that's in there. Enhancing our engagement and accountability. Again, we've touched on this during the course of this meeting, and I'm pleased to say that from next week onwards, we've got a senior communications and engagement individual coming to join us, to join our small team, who will no doubt want to come to these meetings and listen and see how she can help us really take forward that pledge. Creating system sustainability is about recognising the fact that, in common with lots of areas, but we've got some particular challenges about the way our system's financed, about the way we've been using our resources, and we need to address those, and we need to use those better. And then finally, recognising the huge asset that we've got with our statutory and non-statutory workforce, how we look after people better, how we encourage people to come and work with us and for us, so that we've got the right resources that we need to provide the care that we want to do, and how we make the whole area a really attractive place for people to work. And that in turn speaks again to the economic regeneration pledge. We know that careers in the public sector are at an all-time high in terms of applications following the pandemic, and we want to capitalise on that and you know, get people to work with us, but also continue to contribute to the economy. Next one, Joseph. So, Dave, are you still with us? Is there anything that you want to add into this that you didn't say earlier on?
No, I don't think so, really, Nikki. Thank you. You know, we're doing incredibly well.
Yeah, absolutely.
And may that continue. And as soon as we can open up to cohort 10, once that's agreed nationally, and we've got the guidance from JVCI, we will do that. But at the moment, we are where we are, and we will make sure that we try and, as Liz outlined earlier, reach all of those hard to reach communities and people within those communities over the next couple of weeks while we have a slowdown in the programme.
Yeah, thank you. Next slide. I think that might be our last one. Oh, so this is just to record really the vaccination sites which you're aware of. So I'll not dwell on this slide. I think we've perhaps just got one or two more. So just to reflect on the communications efforts that have been ongoing, that I do hope from next week onwards will be enhanced. We will work with you and together to make sure that we're enhancing what we do, and that we try to start explaining the benefits of being part of an integrated care system to the public. As I say, it can sometimes be a bit of a nebulous thing. We don't want it to be that. We want it to be something that's actually going to deliver benefits to the population, and to patients and those people who we are caring for. So we will start to communicate more about what some of those advantages might be. Is there one more, Joseph? So this is about NHS 111 again, which I'll not dwell on. It's there for information. So I think I will draw a line under it at that point. Happy to take any comments or questions. And I'll stop talking at that point.
Thank you, Andy.
Yeah, thanks, Kelly. Thanks, Nikki, for that presentation. I think within there are some really important issues, aren't there, going forward? I mean, in terms of the future of the NHS and its relationship with local government and its voluntary sector partners, absolutely crucial in terms of how the services are going to be delivered over the next 20 years. So I think there's a lot buried in there that we will need to unpack, I think, over time. I mean, I think it's just worth saying that our track record of working together at a local level in Telford and Wrekin is really good with the NHS. I think we've got some excellent examples of partnership work, not least, of course, within around COVID and the vaccination programme, but also in other areas as well. But the ICS takes this a huge step up. You know, this is a massive step change. This is a comprehensive approach rather than doing some very important but project work and initiatives. This is right across the piece. And I think the first thing to say is that we're coming from somewhat different places in terms of the local government and the NHS in our traditions and our ways of working. And that's not meant as a criticism. That's just a fact in terms of the way we tackle things. And we have to have, going forward, in my view, a culture that is a lot more about localities, about population health, about how we address those issues in terms of health inequalities. The ICS white paper does talk about that, and we're all saying the same thing. But I think we underestimate, if we're not careful, what a big change that means in the way of working that's required if we're really going to do this at a local level. It means investment in those health prevention, health promotion initiatives, which we hold dear in terms of our own health and wellbeing strategy locally. It means finding a place in whatever structure emerges for TWIP, which we're rightly proud of in Telford and Wrekin in terms of our partnerships, and it means looking at how the Health and Wellbeing Board can be strengthened in terms of its important role in accountability locally with the local authority, and my sense is that strengthening needs to be around those wider determinants of health, and we've had an example of that today with the allocations, housing allocations policy, but there's all sorts of other cross-sector important areas that influence the health and well-being of the locality. I think the structure for me always comes last. The first thing is to get it right in terms of how we work together and with our partners locally. And you know, I think you probably agree, Nikki, that really does mean a complete rethink in terms of the way that we do things, and we mustn't underestimate that. Thank you.
Thank you, Andy. And I agree with all of that. And I suppose as just a way of working, and I think trust is really important in all of this, isn't it? It's important that we trust each other and we work together. But you know, for the last few months, I've been at the Chief Executives Forum every week, and all the chief executives from the organisations meet together weekly. It's a big commitment for everybody. It's a big commitment for local authority colleagues, but we meet weekly. We try to solve our problems together, and I think that's one step forward. There are many more that need to be made, but yeah, I think it's emerging, and there's a lot to do. I agree with that, but I think the foundations are there.
Thank you. Barry?
Yeah, just a comment on Pledge 9 with regard to enhanced engagement and accountability. I was invited to the Telford Patients First group a week or two ago, and they were clearly very upset about the lack of engagement, particularly on the introduction of the MSK musculoskeletal pathways. They felt it didn't include rheumatology and arthritis, and it was quite a heated meeting, but full credit to yourselves. Whoever the officers were there, they went back to their directors, and instead of trying to bulldoze the pathway through for the 1st of April, they've deferred it for more meaningful consultation. Now, I want to use this example as meaningful consultation for the other 6 strands that's going to be coming forward, that people want to work with you. They really want to participate. They want to tell you what you've missed out of the pathways. But, you know, allow time. Don't try to bulldoze it too just to meet government stands, you know, their standards. We really have to listen to service users and patients. And I don't need to say any more. Thank you. Yeah.
Thank you. Yes, I agree with that.
Liz?
Thank you. I just wanted to come back in on Andy's point and refer to Pledge 3 in terms of it's entitled Tackling the Problems of Ill Health, Health Inequalities and Access to Healthcare. It does feel, I mean, it talks about the population health management approach, and it talks about lifestyle issues. And I just wanted to reiterate Andy's point, is that in terms of the wider determinants of health, and really understanding how important they are, as well as the lifestyle issues, which are being recognised and have been recognised by the NHS for some time. But it's those wider determinants. People's lifestyles and the way people live is dependent on those wider determinants and dependent on those social contexts of their lives. So I would rate, and I think in terms of the NHS, it has a huge ability in terms of being an anchor institution, for example, a large employer of people and a large procurer of supplies and services, that it can really add. And I welcome, you know, the further pledge in terms of economic regeneration, in the sense that that's a pointer to the point I'm making. But I just wanted to reiterate that it's just so much more than just a lifestyle approach that we need to think about.
Thank you, Liz. Yes, and perhaps the wording of that particular pledge isn't grounded as much in that wealth of local authority and local government knowledge about really the things that affect people's lives. But I definitely know where you're coming from, and yes, it is certainly our intent that it is also about the wider determinants of health, as well as the sort of secondary prevention type activities that will be more typically sat within health.
Yes, thank you.
Thank you. And just to say, I'm really keen to see how this board sits within the ICS and it taking the leadership role within that. So thank you. Okay, well, that's great, thank you. And last item, agenda, is 10, is integration of health and social care, health as a place approach. And that's Sarah Downs. Thank you.
Thank you very much, Chair. I'm just going to share a slide on the screen, if that's all right, and then I'll just do a quick summary of the report that you should have in your papers. So bear with me 2 seconds whilst I just get the slide up. Hopefully everybody can see that all right.
Yeah.
Brilliant, thank you very much. So at the end of 2020, the Telford and Wrekin Integrated Place Partnership, or TWIP for short, reviewed its priorities, really to ensure that they reflected the changes and opportunities for further integration that, as the course of the year around the pandemic and the emerging integrated care system, really brought to our attention. Building on what has actually already been discussed today, I'm just going to provide a really short update on these priorities and a few of the key points from the paper. So just a little bit of background just to set the context. The TWIP covers all place-based developments to ensure that prevention, community focus, and a more proactive and collaborative approach. It's been in existence for just over 2 years and is chaired by Jonathan Rowe and composed of senior officers from the Council, CCG, all health providers, primary care networks, the voluntary sector, and Health Watch. The TWIP, as you're aware, is accountable to yourselves as a Health and Wellbeing Board, but also through to the Shropshire and Telford and Wrekin ICS that Nikki's just touched on. On the slide, you can see the TWIP strategic plan for 2020 to 2022 that summarises on one page our vision, outcomes, principles and priorities. Our vision is very much aligned to that of the Health and Wellbeing Board, working together to enable people in Telford and Wrekin to enjoy healthier, happier and more fulfilling lives. And to support this, our principles of working, visible in the flower diagram, the bottom left, have been agreed by all members and include co-production, person-centred approach and one team, to name a few. As reported previously, the TWIP brings together a complex set of activities, but all of them look to achieve the following outcomes for people: care closer to home, integrated and seamless services, one conversation and one point of contact, the right information and advice at the right time. If we look at the priorities in particular, the first priority, so we have 6. The first priority is around that integrated care and support pathways. It's about delivering joined up, effective services, support and care which connects and empowers people to stay healthier and more independent for longer. Some of the examples of this work include the Health and Social Care Rapid Team, which we've reported here previously, the multidisciplinary team meetings with GPs and other partners, the development of the borough-wide learning disability strategy, which is currently out for consultation, and the new work around the Hertfordshire Family Safeguarding Model, which I'm sure we'll hear about at the board at future sessions. Secondly, we have the integrated advice, information and access to support. This is a really key one to delivering the outcomes, especially around that right information and advice at the right time and one conversation and one point of contact for the person. This encapsulates all the work around Live Well Telford as our one-stop shop for everything health and social care, as well as the exciting ILC, which we've just heard about, but also the system-wide pieces of work around a single point of access, which are very much in its infancy. Priority 3 is building community capacity and resilience, which we've touched on quite a bit in today's meeting. And it's a really important one in terms of building on that community and asset-based approach we take here in Telford and Wrekin. It looks at how we work with our community and our amazing volunteers to support this agenda. And as Louise has outlined, COVID has definitely shown what an amazing borough of volunteers and communities we really do have here. Health inequalities, which we've literally just been talking about, is another of our focuses. And this really looks at the integrated response to tackling it. Understanding our challenges will help us all to work together to really reduce these inequalities across the borough, and especially those that have been inadvertently affected by COVID. Linked to that is our 5th priority around prevention and healthy lifestyles. Again, we've reported on this previously, and it's really about ensuring people stay healthy throughout their lives, from birth right through to death. And one of the significant pieces of work here is around social prescribing, and this is progressing at pace through our local social prescribing partnership. Our final priority is very much linked to what Nikki has just been describing around the ICS, and is really about maintaining the identity of Telford and Wrekin while supporting the system. This is about us continuing to influence and direct the system to ensure that we get the best for our residents here in Telford and Wrekin. Some of the work that this will include is looking at delegated authority and further developments of our pooled budget, i.e. what can be decided at place rather than at a system level. The white paper which Nikki touched on is very important to the work of TWIP, as it really emphasises that importance and role of place-based working at a national level. In particular, the recognition that real change happens at place, and the expectation that the ICSs will delegate functions to place-level partnerships. And there's more information in the report if you want a bit more. So just coming sort of towards the end, the TWIP alongside the Health and Wellbeing Board is very well placed to support the delivery of the white paper locally alongside the system-wide ICS. The updated strategic plan that you can see on the screen already starts to address some of those areas mentioned within the white paper and really provides us with a solid foundation from which to build on over the next year and onwards. So the TWIP will continue to build on our strong foundations of partnership working and deliver at pace over the next year. And whilst the next 12 months will be a period of change for the system as we move into an ICS, the TWIP will remain an integral place-based partnership, focusing on improving outcomes for our residents here in Telford and Wrekin. I'm more than happy to take any questions. I know I kind of rattled through that, but just conscious of time.
I'm on mute this time.
Yeah, I was about to tell you, but I thought I'd be a bit more discreet. Yeah.
Put a pound in later.
Okay, so thanks, Sarah, very much for that. I think you've, as you say, it was a very quick presentation, but I think you've summarised really well the importance of TWIP for us locally. I mean, as you're implying, really, it's the health and care partnership in the ICS white paper in embryo, isn't it? I mean, but it's not just we're not just tinkering at the edges so far with TWIP. We've done some really important work, and I mean, your first category there on the slide in terms of avoiding admissions to hospital and ensuring that discharge was carried out efficiently, effectively. You've only got to look at the figures and what we've achieved over the last year to see how effective that has been. And right the way through, we've got some excellent examples of work there. I think we've got to be careful of going forward. And I'd say this to our NHS colleagues, is that we don't, with the structures that emerge from the ICS, kill the goose that's laid the golden egg here. We need to make sure that the effective work and the effective partnership that we've got in TWIP is carried forward into those new arrangements. What we don't want is for a structure that kills this work with organisational and bureaucratic concerns. We've got something that's working. What we need to do is extend it and build upon it in terms of our work at place. And I suppose my vision going forward is that beneath TWIP there sits all the neighbourhood work, doesn't there, that needs to go on around place, and that is just as important as the borough-wide stuff, as far as I'm concerned, and I'm sure Paul will echo that. We've got something here that is really strong, really effective, and which we can work with our NHS partners on as long as we get, and this is a big question, as long as we get the power, and I'll use that word advisedly, to actually commission and deliver at local level. That's what we need from this system, and if we've got that, we can take this a lot further. But thanks, Sarah, that was great.
Thank you. Karen?
Wasn't Paul before me?
That's okay. We'll let you off.
Okay. No. Well, thank you, Sarah. Thank you for that whistle-stop presentation. I understand it's very time constrained, so I think you've touched on all the vital roles. I have read the white paper, but I haven't probably took everything in. I can't seem to take everything in at the moment. And I agree with Andy's comments on the discharges, etc. I think it's great, and obviously the 6 strategic approaches are great. So I just look forward to what else is brought back to the board in the future.
Thanks, Karen.
Paul? Paul? Can you hear us, Paul?
Oh, yeah. Yeah, I can. Sorry. Thanks, Sarah, for that. Can I just say, I was this morning we were at a Lloyds Bank Foundation workshop with the third sector, and it was very clear that integrated early intervention was at the heart of what the third sector want to be involved in across Telford and Wrekin, and just making that connection. I know we already have third sector members on TWIP, but it would be really good to make the connection with the Lloyds Foundation as well, in terms of the work that they're doing across the town, because I think keeping that idea of place-based approach, and as Andy has already said, it's so important that we don't bog this down with a top-heavy approach, that we allow some freedom, we allow some risk-taking in terms of that integrated approach, and look at how we can manage that risk as well, and ensure that it's safe risk for our communities, and move it forward. Thank you.
Thank you. Are there any more questions? No? Okay. Well, Dave Evans wants to say something before the end of the meeting. So if you're ready, Dave.
Thank you, Kelly. And I know it's slightly unusual to allow someone to do this. I've been very privileged over the past 9 years to be the accountable officer of Telford and Wrekin CCG in latterly Shropshire, and very privileged to have been a member of the Health and Wellbeing Board for 8 or so years since it started. Much of what we've just heard from Sarah, all of the Health and Wellbeing Board members will know, is something I've been absolutely committed to all the time I've been in Telford. It's the right time for me to move on. The NHS is changing again. I think I've lived through enough changes to not need to do another one. And I think it is time for someone else to come and have a look and take it forward. There's something about Telford, though, that gets under your skin. And I do leave it with a heavy heart. I think we've made huge progress in developing the partnership between health and local authority over the last 8 years, and I'm very grateful for local authority officers and councillors for doing that. Haven't achieved everything I wanted to do, but I've got some successes, not least in terms of what we've heard about today with COVID and vaccination. So just a huge thank you to you all for your commitment and help and support over the last 8 or 9 years. Thank you.
Thank you, Andy.
Yeah, thanks for that, Dave. And I'd just like to give you my personal thanks for everything you've done for us. And we haven't always seen eye to eye on every single point, but I know that you've worked really hard for us over the last few years, and I do appreciate that. And I'd just like to wish you all the best in your next role. Thank you.
Thank you, Andy.
Karen?
Yeah, I think we all probably echo what Andy's just said. I think you'll be a hard act to follow. I think it's been great that you've been in this position, and it probably seems a long time to you as well, really. But thanks for everything that you've done.
Thanks, Karen.
Cool. Yeah.
Hi, David. Yeah, just wanted to say thanks myself, and you know, we've been on both sides of the argument at different times, different arguments. So I'm just happy that you're, you know, that I've worked with you. I've enjoyed working with you, mate.
Thanks, Paul. Appreciate that. It's been a good 8 years. There's been some challenges. Andy, it'd be dull if we agreed all the time.
And just a thank you from me as well as a third sector worker. You've been a great help, so appreciate that.
Thank you.
Thank you. And remarkably, it's 4 o'clock and we're actually on time finishing. So what was the chances of that today? Yeah, so that's the end of the meeting. Thank you all and good luck, Dave. And thank you all.
Thank you, Chair. Bye, Dave.
Thank you.